name is Dismas Odhiambo Wakla. I'm the CEC in charge of health and sanitation, county government of Siaya. The day we are commemorating today is a very important day, especially for Siaya and this region. Malaria remains one of our greatest health challenges in this region. As a county, and one of our partners mentioned it, malaria prevalence in Siaya stands at a high of 29%. When at a time when the national prevalence rate is 6%. So you can imagine that malaria prevalence in Siaya is about 5 times the national level. In terms of statistics, our data shows us that if you take a population of 1,000 people in Siaya right now, going by the latest data of 2021, you will get 508 of them having malaria. In Siaya, we have 3 particular sub-counties where the prevalence rates are very high. That is Alego Usonga sub-county, where I come from, and where our county headquarters is. Here in Rarieda sub-county, the prevalence is high, and the Game sub-county. Ugenya, Ugunja and Bodo are a bit lower. One of the major areas of intervention that we've collaboratively done together with the national government is distributing free nets to all families periodically. Is it every 2 years? 3. Yes, every 3 years we distribute nets. And the purpose of distribution of those nets is that we want all our households, in all our households, we want everybody to sleep under net. Malaria burden is a big challenge. A number of our health facilities, the major disease we are dealing with. If you go to all our facilities, at outpatient level, the main disease that we are dealing with is malaria. We are currently undertaking malaria vaccination to our infants, 6 months to 24 months. And this is a new initiative. This is a new intervention. And we hope that the outcomes will be good, because what we can do, if we can get it right with vaccination, then I think we will seriously control malaria. Right now, the national government is working with all the 8 lake endemic region counties on a new initiative, which is to kill the breeding. We want to finish the source. The source of malaria is mosquito. The program is called Kenya-Cuba Larval Source Management Project. It was officially launched in Busia 2 weeks ago. His Excellency, the governor, our governor, attended it. That reason that we have this gentleman, Georgenis Garcia Oliva, in our midst. He is an expert from Cuba. He will be taking us through that process. He will be training us and working with our people to help us kill mosquitoes where they are breeding.
Eunice Akinyore. I work in the county government of Siaya as the county malaria control coordinator. According to the latest survey that was done, the Kenya Malaria Indicator Survey that was done in the year 2020, there was an observed reduction in malaria prevalence in the country from the level from 20% levels in 2015 to 19%. That is for the lake endemic region. Nationally, there was an observed reduction of 8% to 6%. However, the prevalence in Siaya County is at 29%, and in this region where we have 8 counties, Siaya is the 7th in terms of high prevalence of 29%.